Good morning. Let me just get
Good
my
morning.
camera going here.
Are you good, man? No worries here.
It always gives me trouble when I it was fine before I came in, but whenever you let me in,
Right.
sometimes it's an external camera. So
Yeah, it starts acting a fool. I've experienced that millions of times, especially when I came back on Zoom and started doing this all over again. Just it just started acting crazy on me, and yeah, it's the hassle sometimes. But yeah, how are you doing today?
I'm doing pretty well. It's great to meet you.
Yeah, it's awesome to meet you, man. It's good doing this. I appreciate you coming on, taking time
Yeah,
to do
no.
this with me.
So glad
All
you
right,
asked me on.
man. Yeah, it's yeah, these are one of the interesting things that um I hardly come across. So I figured I said, hey, this is a pretty interesting one. I want to kind of, you know, pick his brain about this. I just want to see, you know, what everybody can learn from this. So,
You got it.
man, I appreciate it for real though. It's awesome. So, all right, so I'm already recording. We can, jump right to it. So,
You got it.
all
And I'm
right.
a pretty
So,
open book too, so you can ask me just about anything. No, nothing's off
absolutely.
limits.
Absolutely. Yeah, I'm we're gonna get to that too. So yes, we're gonna get some stuff out there. So uh yeah, let's just start this off though, introducing yourself. What do you do now and uh you know why are you doing what you're doing now?
You got it.
All right. So yeah, go ahead, introduce yourself and go ahead and elaborate on what you do and why you do it.
All right. Well, I'm Tim MacDonald. I am in Tampa, Florida.
Okay.
Married to my wife and have a couple grandkids. I'm by profession an online community manager, but my real passion is advocacy because of my cancer diagnosis
Mhm.
and really trying to make an impact for others who are going to face a chronic illness and, hopefully make it a little bit easier for them. I do that through multiple paths, but, a lot of legislative advocacy and a lot of research advocacy are my two main focuses, as well as dipping my toe into obviously creating awareness around, the importance of listening to your body and and understanding, the mental aspects of, what a severe diagnosis can do to you, especially if you're a man, because we're typically like so closed off in how we talk about things and how we open up about things. And so most groups aren't like a good fit for us, but there are ones out there that are specifically for men.
No doubt. No doubt. So to you become, advocacy for an advocate for, cancer, and I was amazed by how the survival rates are, pretty low when it comes down to certain cancers or any type of cancer. And the thing that I've seen that people go through when it comes to cancer is anxiety, uncertainty, fear, and emotional exhaustion in that point. So when you were diagnosed, what went through your mind like immediately?
Yeah, well, immediately, and I got to set the stage here too,
Sure,
because I was
please do.
practicing, a lot of, mindfulness and
Mm,
meditation, breathing exercises, for about a decade before I was diagnosed. So,
okay.
even though I suffered from some depression, earlier in my life, really in the last decade had really focused on like really understanding what was happening and calming myself down, learning not to bottle stuff up inside of me. So when I was told that I had cancer, I actually
Mhm.
took it a lot better than most people do. I was
Oh, okay.
very calm. I remember the urgent care doctor who actually delivered the news to me through a CT scan results told me, like, asked me, like, do you need me to call your wife to come get you, or should we have somebody from the office walk you home or something? Because I was just acting so abnormally compared to how most patients would, which is, I think, your question, like, how did it affect you? And it didn't really. It was just like, okay, it was just like you telling me, oh, it's raining outside. I kind of reacted that way. But I do remember the first honest thought that jumped into my head after like kind of the shock of hearing those words was, what do we do next? And then the next thing was, how am I going to tell my wife when I get home in a few minutes about this? That was the
Right.
biggest thing because I knew she was not
Yeah.
going to take it as well as I did.
Mhm.
And so those were kind of the two thoughts that were happening in my head at the time. The what do we do next? That was, you know, I was lucky to have a really good guy, doctor who actually made a phone call to another doctor, GI surgeon who we worked with in the ER, got me in that same afternoon. So that was my next step. So he gave me that next step for me. But going home and telling my wife was, not quite as easy. But I figured, just like anything else that I had learned in life, if you don't rip off the Band-Aid and say it right away, it doesn't make the problem go away. So just
Yep. Right.
as soon as I walk in the door, just tell her what the news, and we'll deal with how it happens. I can't predict how she's going to react, but we'll just do it. And she was devastated by it, but and she's not a big driver. She, hates driving on the highways and everything, but I was just in such
Yeah.
shape at the time that she had to drive me down there. Well, I drove down, she had to drive back. And we weren't sure when we went down there, were they going to put me in the hospital? Were they going to do that? We had no idea. So she was worried about driving home and already on the phone trying to call her friend to come down and meet her so they could, both of them could drive down. One of them could drive our car back and the other one could drive their car back. But the long story short is it was just an appointment office visit. I had to get a COVID test. It was back in the middle of COVID, back before we even had like, good testing
But
and
yeah, that was my
vaccines.
next question too.
Yeah.
But go ahead.
So,
Yeah.
yeah, so basically, we had to, I got a COVID test, scheduled. I had to go in. That was when it took 48 hours to get the results from it, and then got a
Yep.
colonoscopy scheduled, where they put a stent in me. But those were the biggest things that were like, freaking, her out was just kind of the unknown, the thought of losing me, everything else. But
Hmm.
for me, I was just like, you know what? All I can deal with is what's in front of me. I can't control the fact that I have it now, and I can't
Hmm.
control what's going to happen with it. All I can control is how I react to it right now. And that's basically what was going through my head at the time.
Okay. So, at any point during the whole cancer thing, did reality actually set in for you? Did it actually go like? Did you actually feel like, oh man, I actually have cancer? Did that reality set for you ever at any of that point, or did it, you just was like, okay, like you said, you just face it forward, you can't control it, you're just gonna deal with it.
I think and I want to kind of frame it in a way that makes sense to you and to
Hmm.
anybody listening is
Sure.
the fact that, yes, I did really kind of know that I had it. I knew it was a terminal disease. I knew that I might not be around for too long. But I also knew, like, if I worried about like when that was going to happen, how it was going to happen, everything else, that I was losing time in that moment that I had still here. And so every time I started slipping into that mindset, I would remind myself of the fact of, wait, I'm taking time away from my wife and we just had a granddaughter born, our first granddaughter. I'm taking time away from them if I focus on the what ifs, And
Right.
so I just always reminded myself of that. But I will say that, I actually took that, because there's a 13% chance if you're a stage 4 colorectal cancer patient that you're going to survive for
Yes.
5 years. And in all honesty, I threw all the other statistics out except for that one. But I
Right.
wasn't looking at it from 13% is a very small percentage. I just looked at it from the standpoint of I am going to be part of that 13%. That's all I was
Mhm.
telling myself. And I tell people all the time, that's the only statistic I cared about was 13%, and I am going to be one of those 13%.
Yep. And it's funny because when you think about 13%, you could think about 13% in a sporting aspect. You can think about it, basketball, football, baseball, hockey, or whatever. A team has the 13% chance of winning within the closing minutes of a game. And you know what? Most of the times it's highly possible that can overcome the 13%. But when it comes down to cancer, that 13% hits differently.
Well,
Did
there's
your
definitely,
life,
yeah,
I
there's
was asking you,
definitely a
did your life
difference
feel different?
between like the losing a game and losing your
Yeah,
life, you know?
right, right. Like, did your life feel different? Like instantly when all that happened, did your life
I,
feel different?
I think it did really. And, but I think honestly, it was in a very healthy way. I
Sure.
remember I just talked to my wife and some friends about this not too long ago. I'm like, I've been, no evidence of disease for 3 years now, but some of the things that I really felt helped me when I was in active treatment was my mindfulness and my awareness of, just living life each day as it came and living it to its fullest. And in the 3 years since I've been in active treatment, I've kind of lost some of that, and
Mhm.
I start getting back into the normal day of life where I'm like, I got multiple things happening. I got, this obligation with work. I got this one with advocacy. I got this one for, a podcast that I'm going to be on. I get this one. And, and it's just like, I start like getting a little bit overwhelmed, but I'm like, Tim, for 2.5 years, you solely had one focus, and that was to live each moment to the best of your ability. Just get back into that
Mhm.
mindset again today because that really helped you get, I feel like, I mean, obviously my chemo helped, my surgeries helped, but I really feel like that mindset of being focused in the day, in the moment, really was really healthy for me. And I don't experience that every day, every moment of each day like I do today. So I really think like
Mhm.
I try and bring myself back in that sense to the mental aspect of how I was during treatment because it really was, I think, pretty healthy at the time. But it definitely,
Mhm.
there were moments, and don't get me wrong, where like I didn't like tell my wife because I knew she would freak out. But I had a men's cancer group that I was able to kind of just express myself because I know for me, based upon my earlier life, that if I hold things in, it's not healthy for me. I need to let them out.
Mhm.
And so when I started having like those dark thoughts about like, you know, what will happen to my wife if I die, what will happen to my kids and my grandkids, all those things I was able to just, as soon as they entered my head, let them out into my men's cancer group. And all of a sudden, I had other guys like saying, I know exactly what you feel. I'm going through the same thing. And, that's kind of comforting knowing like you feel like you're on this island. And when you find a community like this, you can express yourself. You're not judged and
Sure.
you get acceptance from the fact that other people are going through something very similar. And that to me was like so helpful for me in my process of working through all this mentally was really the fact that if any of those thoughts came into my head, I could let them out right away into this safe space and then I didn't hold on to him anymore. I was back to my normal self again, and moving forward. And that to me was like, so helpful. But some of those thoughts, I mean, you're talking about like not being here, right? And like, and chemo has cumulative effects. I don't wish it on
Yeah.
anybody, but it's like, you get to certain points where, your body is just so worn out and so, you know, it's hard to explain unless if you've been through it, but it's like a fatigue, not just like being tired because you've been running all day, but like, it's mental, it's physical, it's emotional, it's just all the fatigue on all your senses. And, day in and day out, when that fatigue just kind of accumulates over time, you just get to a point where you're just like, man, is this worth it? I mean, do I want to
Right.
still be here? And I never said, I mean, I obviously never got to the point where I said no, otherwise I probably wouldn't be here. But
Yep. Mhm.
those thoughts do enter your head, and they're there. But again, it just having an outlet, at least for me, that was the biggest thing. Let it out, don't hold on to it, and move forward. Those were kind of, that was my motto.
Absolutely. So now, like, as we're sitting here and we're talking about this, how do you feel? How do you feel?
Um, I feel like in one sense, I feel like I'm on the other side, right? Like
Yeah,
now I'm in a place where I can go back, and the guys who are still going through active treatment, I can be an inspiration and hope for them because I made it
hmm
to the other side, right? And
absolutely.
and I know that not I never try and promise anything because I know cancer has its own mind and we can't
Mhm.
control it. So I don't want to promise somebody that they're going to get to the same situation I'm in, but I can tell them that hey, if you just live each day, if you let it out in our men's cancer group, if you just express yourself, don't hold on to these things. Just focus on what you can control and what you can do today, not worrying about next week, next month, next year. It was so helpful for me that it got me through this and look at where I am today, you know,
Absolutely.
and that's kind of where I am. But the other sense of me is, and it took me, I mentioned I'm 3 years, no evidence of disease now. It took me a good 2 years to get to a point where I could actually be comfortable getting back into these support groups and contributing because I
Absolutely.
felt like I was a fraud going back in there, not in treatment. I felt like I didn't have a place. What right did I have to get back into and tell somebody who was going through chemo right now how I was because I'm not there anymore, you know? And but then it took, talking to a therapist, it took talking to other people who were survivors, and it really took some of the people that were in active treatment telling me, Tim, you were giving me hope. You were giving me inspiration. And understanding that thought that I had that I shouldn't, who was I to be in there? That was very selfish of myself. I wasn't thinking of
Yeah.
others at that time. I was only thinking of myself. And the reality is, I needed to be there. I needed to be helping these people. I needed to still be sharing my story so that other people that are just entering this journey have somebody to look up to because I remember the reason why I wanted that 13% was because there was other guys who had made it 13%, were part of that
Absolutely.
13%. They were the inspiration for me when I first got diagnosed. And if I wasn't there for these new guys coming in, who would be, right? Like they wouldn't be able to latch on to that 13%. Not everybody's got colorectal cancer, but I'm just using
Correct.
that number as
Mhm.
an example. But
Absolutely.
that really is what it's about for me now. It's like understanding that, hey, you were being selfish when you thought about how others were going to judge you. That was on you. You're not thinking of the others. And now I'm like, those thoughts don't even enter my head now. It's just like I'm in there. I talk. I contribute. I answer. Now I don't get into the whole thing about like if they have specific questions about like treatments that I wasn't on, things like that. I let other people that are have that experience or are in it now share their thoughts, but I will actually try and help make connections, like if nobody's answering them and say, hey, I know this person actually was on that chemo medication. Maybe they can give you some help on this. Oh, you want to talk to, a psychotherapist. I know this person who did that because I didn't go that route, so it's
hmm
all these things that we can, I feel like I can be still very helpful in, and I also find it very healing for me,
Absolutely.
but it's also one of those things like, every time I'm thinking about it, I gotta remember that what I went through is still part of who I am. It doesn't define me, but it's still part of who I am and made me who I am today. And I'm
hmm
proud of that now. Whereas
Absolutely.
before I was a little bit shameful of it, it's like
hmm
it's like that chapter is behind me. That's not who I am now, but it still and always will be part of me. And I'm learning to embrace that today.
Absolutely. And I got to ask you this because even though I've never, knock on wood, so to speak, but never been through, you know, any type of cancers right now. So with you being like so far being like not evident of finding any diseases or anything like that, what would you say to people that would keep that maintained, even though there's a lot of things you really can't control about it? But what would you say, like, how would you be able to maintain that healthier lifestyle to where you can try to keep those diseases away?
Yeah, well, I think, and this is true for anybody, right? I think one
Mm-hmm.
thing that I started learning during my treatment was I started remembering if I started having these, negative thoughts or stressors that came in to my head, and just telling me
Yeah,
like all these bad things, right?
yeah,
The first thing that I asked myself was, am I going to be thinking about this an hour from now? Am I going to be thinking about this next week? Am I going to be thinking about this next month? And because my time was pretty short back then when I was in treatment,
yeah,
like
yeah.
literally I knew that I might only have a few years, right? And or
Mm-hmm.
if that. And so for me, like, I know I mentioned this earlier about really
Mm-hmm.
trying to be focused in the moment. If I knew like I wasn't going to be thinking about this again tomorrow or next week, I would ask myself, why are you giving it time now then? And I'd forget about it. It's like, it's not going to matter to me. Get it out of your
Yeah.
head. Stop worrying about it. Stop thinking about it. And that today is still a technique that I use whenever I start getting stressed and overwhelmed. It's just like, am I going to be thinking about this an hour from now? Am I going to be thinking about this next week? Am I going to be thinking about this next month? And usually the answer is always no. And so
Right.
then I remind myself, like, why are you doing this? And I get that thought. I mean, I know it's easier to say than do, but it's just like anything. It's like when you go to the gym for the first time after you haven't been in a while, right? And it's like your
Yeah.
body hurts, but it hurts because you're using muscles that you haven't used. When you practice this, it hurts because you're using, your mind in a way and your consciousness in a way that hasn't been used before. And so just all I say is like give yourself some grace in doing this and understand that yeah, it's not going to be perfect. It's not going to happen the first time. It's not going to happen the second time. But if you practice this for a week and just do it and don't get hard on yourself if you don't get to the even if you don't get past the next hour, like
Right.
if you don't get past that, just remember that you're trying and it's helping and you're making progress. And maybe that next time you didn't make it to the hour, maybe that first time you make it to that hour, maybe now it's, hey, I'm going to make it through to next week. And all of a sudden you start seeing that this is actually working. It is helping. And that is what I think really helps us get out of that obsession of our thoughts kind of consuming who we are and where we're at and what we're capable of doing. Because when we're stuck in our heads, we really aren't fully capable of doing what we're capable of doing.
Mm-hmm. I agree. That's awesome. True story. That's got a true story here. It's a very small true story. So before my grandmother passed back in Christmas Day of 2012, she has spent a lot of time looking for one of her sons, right? And she was never able to find, you know, where he was or anything like that. And he lived in California. So he stayed away from family. He stayed away from me, my brother, everybody, all the family. That's why he moved to California. And she ended up passing away without ever finding him. And we just learned literally, I want to say maybe about a month ago, maybe a little less than that he had passed away from cancer in 2024. And we don't know how he died of cancer, what type of cancer he had. And I'm not going to say that it was a disappointing thing, but it was shocking because, you know, I believe that the type of family that we were, that we could have actually, even though he was in the 70s, so to speak, but we could have actually helped him through this process. But he wanted nothing to do with us. So that kind of changed things. And, it was yeah, everybody was like shocked that, you know, he had passed from cancer. And, you know, it's things that they're trying to process because he was part of this club. I think it was some kind of dark club or something like that. And they was the ones that knew everything. They knew the ins and outs of his life, what he was doing every minute, every hour. We didn't know a thing. And we didn't even know he passed from cancer. And that was the even more crazier part about this whole thing. And I don't even know if like you could say pressure played a role in it or anything like when it comes to cancer. It's like what types of pressure that, you know, people deal with when it comes down to it. Like, are they really like trying to appear to be strong? Some people don't even want to be bothered. They just say, no, don't touch me. I don't want nothing to do with this.
Yeah.
And he went through chemotherapy. He still did everything, but still did not make it. You know, how would you respond to something like that? Like if like and even though you really can't control it or there's nothing you can do about it when it comes down to people that don't want to be bothered with it, you had thoughts about it. How yeah, it's just like even though I can't understand it, but it's just crazy to me on how a lot of people respond to that. You know what I mean?
I think, it's such an important point because I think this is what one thing that I feel really passionate about.
Mm-hmm.
Um, I believed what I believed to get me through cancer.
Yeah.
But who am I to tell somebody else what they should believe on how they should get through cancer?
Yep.
And,
Yep.
I've talked to people. I talked to this young lady who, I think she was, if I remember right, she was colorectal cancer too.
Mm-hmm.
She was very big into holistic medicine and natural, medicines. And, she told me that she viewed chemotherapy as poison. And she did not want to go that route. She did not believe in modern medicine.
Wow.
And she wanted to believe in her faith and she wanted to believe in the practices that she believed in to get treated and she believed that that was going to work for her. And I just remember because that's not my way of thinking. Like I'm not saying I'm
No.
not poo-pooing it, I'm not saying
Yeah.
no, but I remember telling her when I was on that call, I said, you know what is so important about what you just shared with me is you believe 100% in the path that you're going down. And that is
Yeah.
the most important
Yeah.
thing.
Absolutely.
And so that's how I connected with her. I didn't look for where we were different. I looked for where we were had similarities. And my similarities were I knew that if I was going to go down my path, I needed to believe 100% that it was going to work for me. Otherwise, it would have no chance of working for me. And she
Mm-hmm.
believed 100% in the path that she was going down, even though it wasn't the path that I would go. But we're two individuals. We're two different people. And that's okay.
Yeah. Yeah. And yeah, most people don't trust, chemo because of how they could say dangerous it could be. It could be dangerous. But I want you to walk me through your day when you was diagnosed with the cancer. Walk me through your day. What was everything like for you? What did you have to do? What did you have to do for treatment statements, stuff like that? Walk me through that day.
Um, each day was a little different.
Mhm.
I remember being told when I first started chemotherapy to keep a logbook of, like your side effects and how long it took for the side effects to kick in and,
Yeah.
and you just do it and then you start finding these trends and everything. And I did that for about 2 months and then I realized like, this is bullshit.
That's
There's
right.
no patterns here.
Yes. Yes.
It's like there's nothing here. It's like,
Yeah.
it's like this week it's this way, this week it's this way, this week it's another way. It's like it always is like changing. And I'm like, why am I trying to figure it out? It's like just let it happen. And
Yeah.
but my average day, I mean, I will say that, the chemotherapy that I was on, had nausea, vomiting, um, diarrhea, constipation, and fatigue. Those were the main things. And so, and when I mean diarrhea, I mean like, they told me, oh, just use Imodium, right?
Yeah.
And so I was taking Imodium, but if you read the package of Imodium, it says like take no more than six every day, and don't take for more than three
Uh,
days in a row. And I talked to my oncology team, and they're like, don't read the instructions on the box. Here's what I want you to do. I want you to take two when you have diarrhea, and then one every time you have diarrhea after that until it stops. And I don't care if you go to the bathroom and come back 15 minutes later, you take two the first time, and then you take one right after that again in 15 minutes.
absolutely.
And
Yeah.
I mean, that was a game changer, but that took me like 9 months to figure out, to actually get to the point of asking him that question. And but those were my days. It was basically a lot of sitting on the couch,
Yeah.
um, a lot of alone and quiet time. So I really do feel like I mean, that's why I think I was able to practice the mindfulness and meditation so much is because I
Absolutely.
was just on my own and didn't have any distractions around me. A lot of people might think like I don't know if you ever did this writing assignment. I remember in one of my first community college classes I took in writing, it was like you're in a blank room with no doors, no windows, no trim, nothing else is in there, and it's dark. Now write 10,000 words. And
Oh,
most people had such a difficult time doing that because it's like it's black, right? It's empty. You can't
yeah.
see anything. But
Oh,
I realized it was about, and this goes back all these years ago, right? It was about getting back into how was I feeling? What was I sensing? Did it change over time, even though nothing in the room changed? And I had no
yeah.
problem writing the 10,000 words. And so I think this mindfulness sitting on the couch, it was really bringing me back to that sense of like, this alone time is wonderful. It's opening up my creativity. It's opening up, connecting with my true feelings, my inner feelings that I have. And
Yeah.
and to the point that I made earlier, I kind of know that that was really healthy for me at the time, and now I don't have that time to do that as much anymore. So I try and remember to go back to that when I can, even though it's in kind of micro doses now compared to basically an average day for me back during treatment.
Yeah. Hey, but that creativity, man, is a big thing. So yeah,
Yes.
that's good for you, man. That's good for you. So when did you start, even though I really don't know the process, so I really don't want to think of it as a dumb question, but I just have to know like the systems. Like, there's systems. Everybody would tell you, okay, the systems for this, the system for that, and it's this, and this. Are there any symptoms to where that you start to feel like it's that the diseases are no longer there? Is there a system for that, or is that something you just have to go to the doctor, get it checked out, and see like internally if it's gone?
Yeah. Well, for colorectal, I know like because I had some of these symptoms before I was diagnosed, right? Um,
Yeah,
and so like for that, it was basically, I mean, and I'm gonna list them all now that I experienced,
sure.
even though I didn't know it was cancer at the time. I was
Mhm.
having a weird just feeling of getting sick. Not all the time, but like it would always happen like in the evening, I would have these
Ah,
I would have these weird back pains, not like a back pain like I've experienced before, but like just a weird pain in my back. Um, I would all of a sudden I live in Tampa, Florida, right? It's the middle of summer. I'm like, it's hot, it's humid. Our daughter's air conditioning was set a little bit lower than we have at our house. Whenever I was there watching our granddaughter, I was freezing. I'd have to go outside to warm up. So I was actually getting the chills inside. At night, every once in a while, I'd start having night sweats. Um, you know,
yeah.
But the thing that brought me into the urgent care was it was Thanksgiving and I had a bad pain in my lower right side. And even then I didn't
Yeah.
go. I just said, well, if it's not gone by Monday, I'll make an appointment and go in. And it just got worse each day to the point where on Sunday morning my wife got up. She was always bugging me, are you going to go today? Are you going to go today? And she woke up and she's like, I said, I made an appointment. And she goes, I thought you weren't going until tomorrow. And I said, it's just too bad. I need to go today. So those were the symptoms to get there, right?
Yeah.
Um,
Yeah.
Now, if you know if it's good, right? If you know if the
Mhm.
cancer is gone, um, and I still do this today, they do a lot of scans. So when you're in active treatment, you do scans every 3 months. Um,
Right.
there's blood tests, there's everything else. So knowing it was gone was pretty easy, and especially since I got a liver transplant, we did in order to qualify as a colorectal cancer patient to get a liver transplant, you basically need to have they need to determine that the cancer is gone from everywhere else in your body except your liver.
Mhm.
And so they did that. They took my liver out. And so as soon as they took my liver out, we knew, I mean, as well as we could know, that there was no other
Yeah.
cancer in my body.
Okay. Cool. Yeah, that was one of the things that really, got me curious because I know like there's always systems for something. There's always, a system for that. And I was just wondering, like, man, is there like a way that there's a system for that for like where it like it disappears and then you only have to realize or go to the doctor to get it checked out and stuff like that. But yeah, you pretty much answered that question in that base because I that was like a curious thing for me. It was.
Well, and I was going to say for colorectal cancer, and I didn't mention this, if you have blood in your stool, if your stool changes, like if it's, really small, if it's hard, if there's not a lot, if you need to go frequently, those are all potential symptoms too that you should get screened for colorectal cancer as well.
Mm, yep, that's a good one right there too. So how does a diagnosis change the way you saw yourself? I think you touched up on it, but uh yeah, let's go a little deeper. How did that diagnosis change, the way that you saw yourself?
Yeah, I think it really made me realize that I know we all know this, right? But
Hmm.
we're only here on Earth for a limited amount of time. And
Correct.
I think it made me realize once I had cancer that, you know, I'm just a very temporary fixture in this big planet and universe that we live in. And I think to me that meant like I am not going to go through the daily grind just to go through the daily grind because society tells me I should go through the daily grind.
There you
I
go.
am going to start living my life the way I want to live. And, my wife and I started traveling when I was on in treatment because we love traveling and we've wanted to see places that we never seen before. And, we went on a 3-week trip to Europe last year and we already have another trip to Europe to see some different places this year.
All right.
So it's like, we are doing things that we want to do, not waiting for the optimum time to do them at. And I think that's what
Mhm.
opened up in my mind when I got cancer was just that we are temporarily here. What do you want to
Yep,
do with that time? You know,
exactly.
I remember somebody said this a long time ago before I was even diagnosed, but it's so appropriate. It's like you only have one life and it's not a practice run. There's no practice
Mhm.
runs. So what are you going to do with it? And that's kind of how I apply things today. It's I don't just do things for the sake of doing them. I do them because I truly believe I want to be doing them right now. And
Yeah.
yeah, I might decide after I do it I don't want to do it again, but like hey, let's give it a try if I really want to do this and make it happen.
Mhm.
And that to me is like it's a gift really. It really opened my eyes up to the fact that, you know, I don't need to save for retirement and, be planning, having $1 million in the bank and, how I'm going to
Yeah.
live when I'm
Yes.
80, 90 years old. I mean, I, I know that might be, harder for younger people to understand, but, I'm
Yeah.
in my late 50s now. I'm getting closer to that. And I still don't even feel like I need to be that way because
I agree.
who knows when cancer comes? Who knows when we get hit by a car? Who
Yeah.
knows when, when we lose our job or, the an asteroid hits the planet? I mean, who knows what's going to happen?
Right. Right. I understand that. Yeah, that's one of the things that I also see too. And sometimes it can be pointless. And like you said, it's a temporary life. So it's like, yeah, how are you gonna spend it? And you talked about how you went on trips while you were still ill. Like how how did that really make you feel like you still being ill? Because it's kind of like I don't want to put it in the wrong way, but it kind of feel like a death wish. Not a death wish, but like last wishes, right? And you're taking these trips and things like that. How is like you explain on how, you know, the treatments treat your body and you could be exhausted and stuff like that. How was you feeling when you was taking these trips? Did that just adrenaline come overcome it, or was it just something else that you just felt like, okay, I'm just gonna do it regardless,
It
because
it
I feel like I
it
do it.
yeah, it really and I mean I remember this so vividly because we went to Curacao.
Yeah.
Um and we went to a Zoetree hotel. I think it was kind of at the tail end of COVID, so I mean it was travel was still just starting to come back then. And so, I think the flight was only like half full. The hotel that was normally like $700 a night, I got for like $300 a night. It was a really nice
Oh,
resort, area.
cool.
Um, you know, we got there and I had just had chemo and
Hmm.
I just started back up on chemo, I think, and I was really having like every little thing that I put in my mouth, I would throw back up again, you
Oh my
know?
goodness.
And I remember calling my oncology team from Carousel on the second day and saying I was explaining what happened, asked if I should fly back, do I need to do anything? And they're like, "No, you're on vacation. Enjoy your vacation. Um, drink electrolytes, drink Gatorade, Powerade, find something. See it as much as you can. Do that. If you still are not feeling good and you're not able to keep anything down, find a local hospital and get some fluids in you, IV wise." And I said, okay. And so I went to the gift shop at the hotel. I bought a couple of Powerades. I, drank them. And later that day, I felt just back to myself again and we can enjoy ourselves. And I know that I was a little bit slower and more cautious because my balance was not as good.
Yeah.
The fatigue was in. So like walking down the stairs in the pool, I was not like the
Yeah.
old me just would have, right in the water. During treatment, I was very cautious, one step at a time, holding the rail, walking down. But the sensation I had when I was on vacation, for the most part, I mean, I know I just told you I had to call my oncology team, but
Yeah. Uh-huh.
for the most part, when I was on vacation, it was like I get to be, I know I'm still going through treatment, but this is like a break from everything.
Yeah.
I can get away from the daily routine. I can get away from having a clinic visit, having an infusion. I can get away from the scan. I can just live life with my wife and be in a beautiful place and experience this beautiful scenery, the clean, clear water. It was just
Yeah.
like it was so peaceful, I guess is the best way to say it, when I went on these trips. It was just so peaceful. And,
Yeah.
then when I'd come back, even when I had to go, because I usually planned it like I had infusions every 2 weeks, so I'd plan it like we went on vacation, I'd come back, I'd go right into an infusion. But when I went back into the infusion, I would be feeling really good. I'd be able to talk to my infusion nurses and tell them what we just did that week. And that
Yeah.
actually brought me joy while I was getting chemo,
There you go.
reliving the experience that I had just had.
There you go. But you gotta help me understand something on this. You said like the doctors told you electrolytes. What does that do to your body? What does electrolytes do to your body when you have cancer like that? I don't understand that.
Well, I don't know exactly what it is, but I guess it helps your body like be regain its energy a little bit.
Yeah.
And so like if you think about it, that's Gatorade was developed for the University of Florida football team, you
Right.
know,
Yeah, I
for the
remember. Yeah.
athletes, right? So
Right.
that they could recover better than just drinking water. They would have electrolytes in it to be able to kind of regenerate their muscles, regenerate their energy in their body.
Absolutely.
And I think
Yes.
that's what it does for cancer patients. It helps kind of re-energize your muscles in your body, helps you get a little bit more energy and strength going again. So I'm not saying that from a medical perspective. I'm just using that from a
Right. You
logic
just you
standpoint.
I
Yeah.
got you. I understand it. It was because it was just odd to me because, I'll hear one side that electrolytes is, good. It could be good for refueling and stuff like that. But then I hear the other side. I hear, electrolytes may not, do the things that you want it to do. And you saying that, you was trying to eat things and stuff like that. And sometimes food can be a natural health type medicine with these different types of health issues. So that's why I was kind of confused on how electrolytes was helping you and no food was keeping you down. And that's like the main ingredient for like helping with health, like main health issues. It just threw me off. I was like, I gotta understand that more. So yeah, I got to understand that more. That's right there is like I thought that was pretty
Well, I
interesting.
I can tell you, Darrell, that while you're going through treatment and I mean, yes, I saw a primary doctor once a year, but I saw my oncology team every 2 weeks, right? And
Yeah.
and I talked to them in between those sessions via my patient portal. But I will
Yeah.
tell you one thing, your oncology team, when you're in active treatment,
Mhm.
cares about one thing, and that's your cancer and you being able
Yes.
to get your treatment. And so the two big things they say is fluids and protein. Those are the two
Always.
things.
Always.
They don't care, like they don't care what kind of food you eat as long as you get your protein. They don't
There you
care what
go.
you drink as long as you're getting fluids.
That's right. Yep, I hear that all the time too. Protein. That's one main important thing. That's what I've been focusing on now too, because I'm a type 2 diabetic. And the more number one thing I've always been focusing on is protein. So that I understand. I understand that. Yeah, for sure. So you talked about, meditation, and I think you touched up on emotional grounding and staying mentally centered. Do you still meditate to this day, like today? Do you still meditate?
I do, but probably not in the way that most people think. I don't like sit here and close my eyes and have my
And
hands up. And I learned this from a friend of mine who
Mhm.
she always told me she went to like Bali and all this stuff on these meditation retreats and everything. And she said everybody was under the gazebo, on their mats doing their thing. And she was out in the ocean naked doing her meditation and
Yeah,
dancing in the water.
yeah,
And I'm like,
yeah.
oh, there's no right or wrong way to do this, right?
No, no,
and
never, man, never.
and so I find myself, even if it's in very small doses, just like if my mind starts going, I'm just like, okay, just let's just focus back. Let's just bring this back to center again. And I kind of do it on the fly,
Yep.
but in very small doses. But I mean, I don't suggest you start that way. I suggest you start like actually really practicing meditation. And then
Yeah.
once you get to a certain point where you feel like you're starting to see results, then you can start figuring out what is the best way it works for you. How does it work? I mean, I used to physically write out like this script on a piece of paper as the thoughts came into my head to be able to analyze what was happening in my brain. Now I can have that same conversation in my head in like
Absolutely.
seconds, you know? But for the first couple months, I was writing everything down. It took me like 15, 25 minutes to write everything down and then read it again and understand what was happening in my thoughts. And now those thoughts just happen in my head. And they take literally seconds because I know as soon as it starts happening, I can skip all the middle stuff and skip the small talk and just say, here's what I want. I know here's what your answer is, and here's what I'm planning on doing, and
Yeah.
just do it, you know?
Yeah, man. No doubt. So I want to ask you this based off of, there's men out here, like, or people in general, doesn't matter, rather if it's men, women, well, mainly men that deal with vulnerability and mortality, so to speak. How do men process fear and mortality differently?
Hmm. I think I think it stems from the fact that we've in at least in our society, right? Like
Mm-hmm.
we have been brought up to believe that men shouldn't be fearful, right?
Right.
Like we shouldn't be afraid.
Yes.
And and because if we are afraid, that's a sign of weakness.
Right.
And what I've really realized is that, you know, sometimes if you want to call it weakness, right? But if I can acknowledge my fear, if I can understand my fear, if I can understand that it's acceptable to have those fears, that to me is a sign of strength.
Yeah. Absolutely.
And so I think that vulnerability comes from being able to understand that what society is telling us might not actually be how we need to be. And when
Right.
you can start looking inside yourself and understanding who you want to be, all of a sudden now you can start dealing with those fears, expressing those fears, and sharing in a more vulnerable way that really is a sign of strength, regardless of what society is going to tell us it's a weakness.
There you go. I agree wholeheartedly. That's absolutely right. What has surviving cancer taught you about life that most people don't understand?
Wow. Um, I think one, it's taught me who's important in your life, right? Um, you know, um, you know, you have a lot of people that were maybe in your life before you had cancer, and then you got cancer and they
Mm-hmm.
disappeared.
There you go.
Um, you have, you know, maybe blood relatives, right? That
Mm-hmm.
bring your energy down all the time. And one thing that I learned about having cancer was I don't need to be around. I need people that lift my energy up. I don't need to be around people that bring my energy
Put them
down.
down. Yep.
And so even if they're blood relatives, they can still be my blood relative. I just don't need to spend time with them,
Yeah.
you know? And some of my friends who aren't blood relatives are like family to me now because they actually lift me up. And so
Yes.
it's really kind of it's almost like unlearning everything that I learned in my life and then redeveloping a new set of standards for what I believe and what I want to learn in my way now.
Yeah.
Um, and I think that that is like so powerful because now I surround myself with people who do lift me up. And you know, I there's this guy who I know. I met him online, and we met in person once, and he
Mm-hmm.
actually suggested where the area we live here in Tampa now. When I was flying down to look for a place, and he was married and had kids, and now he's I mean, he came out as gay, and he's
Mm-hmm.
living on his own, and he's like looking for a partner, and he lost his job, and he's trying to keep housing and all this stuff, and he's always chatting with me about like these really depressing topics and how he's feeling.
Yeah.
And my first thought was, oh, I just need to cut him off because he's bringing me down. But
Yeah.
I'm like, wait a minute. Here's somebody in need, right? Here's somebody who helped me in the past, who
Yep.
is in and he probably has nobody else to turn to, right? Because that's why he's always talking to me, that
Yeah.
he can come to me. And so instead of me looking at taking me down, I'm like I'm sharing things in a way to him the other day, um, he went on this big rant. I think it was on Monday, and I didn't respond right away, which I usually
Hmm.
do. And yesterday I
Yeah.
responded to him, and it
Hmm.
was just in a way that hey, I've never been in your shoes before, but you have another month at your place. Most
Yeah.
rental places don't even start advertising until a month before they have openings. So
Oh yeah.
it wouldn't have mattered if you got 2 months notice because you wouldn't have been able to find a place for, until you were a month or less in. So that's a
Hmm.
positive, right? Like
Yes.
there's nothing wrong with
Yes.
that. This is good
Yes.
timing for you. I'm trying to help them see like sometimes I think when you're in a really dark hole, it's hard to see any light. And all I was trying to do is let him see that there is some light in what he's telling me from my perspective. And maybe he
Yeah.
can see that light. And the bottom line was he opened up yesterday and all of a sudden it was like, thank you for listening. I
That's
know
it.
I just needed to get it off my chest. And so for me,
Hmm.
that was like, I'm not saying I just get rid of everybody, but I'm really careful about the people that I choose to be around that are kind of downers compared to the uppers,
There you go. There you go. So I give you credit, right? Giving you credit for surviving cancer. So besides yourself, who would you give the biggest credit to in helping you through your cancer journey?
Wow. Um, I mean, I can't
I
name
know
names.
there's, yeah,
There's
I
too
know.
many. There's too
Yeah,
many.
I get that. Yeah, totally get that. Like, there's a lot of people that can actually come in and be, right there with you through the beginning to the end, you know.
Yep.
And I know like you have, your wife, and you have the
Yes.
doctors and stuff like that,
Yep.
you know. But I ain't want to put you on the spot like that. But
No,
sometimes
but I really think that the fact, well, I'll tell you where all this started though. It
yeah.
starts with myself,
Yeah.
right?
Hmm.
Because if I don't open myself up to receive their help,
Hmm.
they can't help me.
There you go. There you go. Like,
And and that was the power in sharing my story too, wherever I
hmm.
was. We went on these
Hmm.
trips, right? And we were in Orlando, and I saw another guy because most chemo patients have a port and it sticks out of your chest a little bit. It's like a little bump.
Yeah.
And
Yeah.
that's instead of giving you an IV with your chemo in your arm, they actually use your port and put the chemo right into your vein that goes through your heart. And so
Yeah.
I saw you had a port, and so I knew he was probably a cancer patient. And I saw his wife, and she was sitting next to us at the pool, and we struck up a conversation. And long story short is he did have cancer, and she showed us his arm was all had these enlarged lymph nodes. It was like hanging down on his arm,
Oh
and
man.
he probably didn't have too much longer to go. But they were just trying to live their best life, and we talked about that. But she told me something, and I'm not a very, I was brought up Catholic, but I don't practice any religion today.
Sure.
And,
Sure.
when people used to tell me that they were praying for me, I'd be like, yeah, yeah, thank you, but then I'd dismiss it.
Yeah.
And when I got cancer, what I learned was I needed to be open and grateful to receive it.
Yes.
And so, just because they said they were praying for me was no different than somebody saying they were sending me positive energy, that they were sending good vibes, that they were sending me good juju, whatever it was.
Yeah.
That was their language for what they believed in that they wanted to send me. And I
Hmm.
needed to receive it with gratitude. And I told this
Yeah.
lady this because she was pretty religious and she was also a nurse in oncology. And
Yeah.
we were talking, and she just looked me in the eyes and she said, "Tim, you get it." And she gave me a giant hug. And I mean, but that would not have happened if I didn't open myself up to starting that conversation with her.
Yeah.
And I can't tell you how many conversations I've had with people just out and about, when I'm at a restaurant, when I'm walking
Yeah.
down the street with my neighbors, you know, I mean, whatever it is. And and when you do that, and I think that gets back to that being vulnerable, right? Like sharing your story, like, yeah, cancer is not the most pleasant topic to talk about, but if you're one-on-one with people, usually they want to hear what's going on in your life. And if you're open to
Hmm.
sharing that, and then open to people telling you that they're going to be thinking about you're going to be praying for you. One of my neighbors, she's in this online global prayer group, right? What do they call it? The prayer angels, or prayer chain, or whatever. And, she said, "I'm going to put you on there. There's tens of thousands of people that are going to be praying for you, because I put your name on that list." And
Oh,
I said, "Thank you so much. That means so much to me. I really appreciate that." And so when you ask who, I'm just giving this as an example, because if
mhm.
I wasn't open enough to receive that, I probably wouldn't be here today.
There you go. And that's exactly why, like, when I mentioned first, is that, you always give yourself credit.
Yep.
You always give yourself credit because if you would have never been open to everything that people spill onto you, you probably wouldn't be here. But I tell you, I am so happy. I am so glad that you are here telling your story. The best thing ever. It is. It's the best thing. And I
Yep.
understand that you're an author, right?
I
You've been
am. I
writing
just
books.
I just wrote a book, from patient to advocate, and it really talks. It's not just about my story, but it's about like how I got involved in advocacy that gave me meaning and purpose,
Mhm.
that helped me get through my treatment, and
Yeah.
encouraging other. It's basically a guidebook for others in chronic disease spaces to get involved in advocacy as a way to have meaning and purpose in what happened to them.
All right. So how else will people be able to get in touch with you?
Well, they can check out I actually do a podcast on advocacy too, and a
All
blog.
right.
And I do touch on mental health a lot, because
Okay.
obviously survivorship, cancer, grief and loss comes with a lot of, mental aspects that we need to deal with.
Mhm.
So that's on advocacyatwork.com. It's a
Okay.
Substack, where my podcast is also. And then you can always reach out to me on LinkedIn too. I'm very open to connect with people on LinkedIn, and it's just Tim A. MacDonald on LinkedIn.
All right. That's cool. This is why I do this, man. Like, it's enjoyable just to hear other people's stories. Like, this has been the best thing that's happened since I've restarted back doing the podcast because people struggle mentally. I struggle. I deal with depression, anxiety, and being able to do this podcast and be able to, share my thoughts individually and then having people come on and share their stories has been the greatest feeling that I've ever have experienced. Like before then, I wasn't even, I wasn't even feeling this way. I was just more depressed. I was more anxious about whatever. And restarting up this podcast that's just brought me into a lot of more learning from everyone that's come on the, to share their story. And you just brought a fresh perspective from a cancer perspective. Man, it's a real thing. Like I enjoy listening to it. Like I love when people, you know, can say, "Hey, you're not alone," right? And this has been great. It's really been great, and I
Well,
really
thank you.
appreciate you coming on.
No, it was my pleasure. It was such a joy talking with you, and I
Mhm.
really commend you for doing this, because I mean, I know we both talked about this. It's
Yeah.
kind of like a champagne bottle, right? If that's what our minds are, And
Yes.
if
Yes.
if it's all bottled up in there and it's shaked all around all the time, it's going to
It's
explode at some
gonna
point.
explode.
And
Yes.
usually that's not good. That's not
No,
healthy.
no, it's not healthy at all. You're like, you want to get all that out before you even bother to open that
Yep.
up, man. You want to just open it up at ease. You don't want to get into the experience where you're keeping it all bottled up and then poof, it's everywhere. And it's like, firstly, physically, how I'm gonna clean this up, and two, where do I start? So it's it's
Well, and usually,
yeah,
usually it starts impacting other people when we do that as well.
there you go. That's right. That's right. But Tim MacDonald, man, I appreciate your time, man. I appreciate you coming on talking to me, man. This was great. Always been great.
Well, thank you so much, Darrell. I really appreciate it.
And thank you, man. I appreciate you.